Hello everyone, so let's start with the session now. So we can start the topics, and today's topic is Deep Cervical Fascia targeted for NEET PG 2021 and also for the first year MBBS students. Actually it's a very important topic, and it's very important that you should know the whole anatomy of deep cervical fascia. It is having 3 layers, and it is important for you to know the extent of the layer, what it is enclosing, and what is the extent of the different layers of deep cervical fascia in horizontal and in vertical tracing. So we will study the topic in detail. So before that, I would like to give you the introduction about myself and about the platform of Unacademy. So I have got 8 years of teaching experience for the past 8 years for the various competitive exams in the medical field. I have done my MD Anatomy from Armed Force Medical College, Pune. So my dear aspirants, I would also like to give you the details of the Telegram group link of Let's Crack NEET PG. So do join the Telegram group link, that is Let's Crack NEET PG, where you can get the link of all the sessions which is taken on the YouTube, and also of Let's Crack NEET PG, and also the special free sessions on the Unacademy platform along with all the plus courses being started on the platform. So this is the opportunity which can be availed by you. Okay, so yes, okay, so I would also like to tell you how you are going to ask a doubt. So for asking a doubt, click on ask a doubt on the screen, take a picture or choose from the gallery of the screen, crop the image to specifically highlight the question. DG Patel, welcome to the session dear. Select the correct subject to which the questions belongs. Okay. Now thereafter download the Unacademy app, and after downloading the Unacademy app, find your goal as NEET PG. So you will find your goal NEET PG. So what is your goal? NEET PG. Thereafter you will type my name, Dr. Monalisa, and the updates and the links of all my upcoming free sessions on the platform of Unacademy will be showing. So you can join my session, that will be highly beneficial for you, which is lying on the free platform. So for seeing the free sessions on the Unacademy platform, what you can do, you can download the Unacademy app and then use my code ANAT10. So you can use the code ANAT10 for unlocking the free sessions on the Unacademy platform if you are using the platform for the first time, downloaded the app for the first time. So also I want you to give the information regarding tomorrow. So tomorrow is 24th, and tomorrow do join my session of 13th session, or you can say last session of 200 anatomy MCQ series. This will be highly beneficial. So I am within for the last 1 week I have started this session of 200 anatomy MCQs, in which previous year MCQs has been discussed. So what I want that you should join this session, and this is the part 13 of the session. 200 anatomy MCQ has been discussed on this. So tomorrow is the timing, and what is the timing? 6 p.m. is the timing. So yeah, so this will be the timing for the session, that will be highly beneficial for you, and this will be on the platform of Unacademy. So yes, 6 p.m. is the session on YouTube, so maybe I will take out 7:30 p.m. So is it okay? 7:30 p.m. would be greater. So let me just make it 7:30 p.m. So all of you do note down, tomorrow on the free platform 7:30 p.m. I will take the session. 7:30 p.m. 6 p.m. is the YouTube session on Let's Crack NEET PG, in which I am again coming up with an anatomy quiz, and 7:30 p.m. I will take this session. That is the session of 13th part of the 200 anatomy MCQ series. So this is on the free platform of Unacademy. Special class features, interactive live classes there, polls are conducted. So what do you mean by interactive live class? That means you can ask doubts right in the session itself. You can get your doubts cleared by the person who is taking the live session, and thereafter polls are also conducted. You can be the part of the polls, and you can see where you stand among your competitors, and it can have a healthy competition in a way. Raise your hand and ask a doubt, never miss a class. So also what is important, if you are attending my session and you find it that you have to follow my session, you have to start following me on the Unacademy platform. So if you start following me on the Unacademy platform, you will get the links and updates of all my session. After completing the session, you can have the PDF of lecture note. You can study from any time, anywhere. All these things are the highlights of the special free sessions on the Unacademy platform. So don't leave it, and tomorrow join me 7:30 p.m. the session. You can join me 7:30 p.m. free session. 6 p.m. will be the YouTube session. Now, referral code is an ANAT10 which can be used by you for getting 10% discount or for downloading the Unacademy app and seeing the free session. Unlock code की तरह हम इसे use कर सकते हैं. You can use it as a unlock code. Subscribe, like and share. Let's crack NEET PG platform. And referral code which can be used is ANAT10. So you can use this referral code and you can get 10% discount if you want to take the plus subscription of Unacademy, or you can use as a referral code also as a unlock code. Now, Bugs Bounty is a opportunity for the learners to report any inappropriate content which is found on the videos provided by the educators on the Unacademy platform, and if you are first to report it, you will win exciting prizes. All the best. So let's start with the topic, that is the fascias of the neck. Deep cervical fascia is the topic, so I will start with the fascias or deep cervical fascia in detail. So when I am talking about the topic deep cervical fascia, what is the other name of deep cervical fascia? So the other name of deep cervical fascia, it is also called as fascia coli. So it is also called as fascia coli. Got it? It is also called as fascia coli, and it is actually investing the whole of the neck and feels the interval which is lying between the muscles, vessels and that of the viscera which is located there. Got it? So it is actually surrounding the whole neck region in the form of a layer, sheath. It forms a sheath which is surrounding the neck region and forming fascia coli, which forms an investing layer kind of thing for the muscles of the neck and viscera. So as you can see, it is made of 3 layers which is shown in the diagram. So it is made of following layer: deep cervical fascia. So it is having investing layer of deep cervical fascia. It is having pre-vertebral layer, pre-tracheal layer and carotid sheath. So all these structures are actually modification, are formed from which layer? All these structures are formed from the deep cervical fascia. Deep cervical fascia in generally, as we describe deep cervical fascia from outside to inside, the most outermost layer will be the investing layer of deep cervical fascia. So here this layer is the investing layer of deep cervical fascia, and from investing layer of deep cervical fascia, other layers, that is pre-vertebral layer, pre-vertebral and that of pre-tracheal layer arises, and also carotid sheath is formed. So we will see each of these layers in the detail. So firstly, let's start with the deep cervical fascia. So I would like to give you a definition of deep cervical fascia, as we have seen that it is made of 3 layers and it is covering whole of the neck. So please write down the heading deep cervical fascia. Deep cervical fascia. So when we are talking about deep cervical fascia, in generally it is described as formed of 3 layers from outside to inside. So it is formed of 3 layers from outside to inside. It is formed of 3 layers from outside to inside, and the layers are, these layers are investing layer of deep cervical fascia, pre-vertebral layer of deep cervical fascia and pre-tracheal layer. So pre-tracheal layer of deep cervical fascia and pre-vertebral layer of deep cervical fascia. So these are the 3 layers as ones move from outside to inside, and the space which is located in between the pre-tracheal and pre-vertebral layer forms as there is a space. So when we are talking about the space which is lying between pre-tracheal and pre-vertebral layer, it is forming the visceral component which is containing mainly thyroid, trachea, esophagus. Carotid sheath is also derived from pre-tracheal pre-vertebral layer, which is itself deriving from investing layer, and it is forming the neurovascular compartments. Okay, so this is how the compartments are formed. So what does this means? That the deep cervical fascia is made of investing layer and pre-tracheal pre-vertebral. Another spaces which is formed in between these layers are forming neurovascular compartment and that of visceral compartment. So write down the space lying between pre-tracheal and pre-vertebral layer forms the visceral compartment around trachea, esophagus and thyroid gland. Got it? And the carotid sheath is forming neurovascular compartment. Why neurovascular? Because it is containing arteries, veins and nerves. So, it is forming neurovascular compartment. Okay, so these are the general information which I have given about the deep cervical fascia. Now let's describe each layer in detail. So सबसे पहले क्या पढ़ेंगे? The first layer which I want you to know is the investing layer. Are you understanding? Let me know, Dr. Patel, DJ Patel and everyone, if you are understanding. Any doubt, let me know. So let's start with the first layer which we will study in detail is the investing layer of deep cervical fascia. So before starting that, once more I would enlarge this diagram and let you see the layers. So this outermost layer which you are seeing here, this is the investing layer of deep cervical fascia. This whole is the investing layer of deep cervical fascia. Now inside it we have got the visceral, pre-tracheal fascia and pre-vertebral layer. So again you can see here the pre-tracheal fascia, okay, which is lying inside the investing layer, and underlying we have got the pre-vertebral layer, posteriorly pre-vertebral layer, and also in this diagram you can clearly see the carotid sheath. This is the carotid sheath. So done with this, we can see all the layers here, okay. We can see the layers here nicely as shown in the diagram. Yeah, okay. Now thereafter let me tell you about the details of investing layer. The first layer which we are going to study is the investing layer of deep cervical fascia. Investing layer of deep cervical fascia. This is the first layer which we are going to study. So actually when we talk about investing layer of deep cervical fascia, when we are talking about investing layer of deep cervical fascia, first thing which I want to tell you is the location. Where is this layer located? So exact location of this layer is that it is lying beneath the platysma muscle. So it is located, it lies under the cover of which muscle? Platysma muscle. And what is platysma muscle? It is lying under the cover of platysma muscle, and platysma muscle is the muscle which is lying in the superficial cervical fascia. So this is an example of which muscle? This is an example of panniculus carnosus. This is an example of panniculus carnosus. Investing layer of deep cervical fascia is an example of panniculus carnosus, and it is located under the cover of platysma muscle, investing layer of deep cervical fascia. Okay, any doubt? Let me know. Let me know the aspirants. Now, next important point is the attachment. So, next important point which we have to know is the attachment of investing layer of deep cervical fascia. Next important point is the attachment of investing layer of deep cervical fascia, which is very important. So it is very important that we should know what are the attachment as we move from above to down, anteriorly, posteriorly, inferiorly. So every attachment is important to know. Thereafter we will study about the extent. So when we are talking about the posterior aspect behind, so let me show you this diagram. Okay, so when we are talking about the posterior aspect of behind, the attachment will be on ligamentum nuchae. So see here in this diagram also it is shown, this is the ligamentum nuchae, okay, ligamentum nuchae which is lying on the posterior aspect of the neck, and this is having more of elastic fiber. So it is attached to the ligamentum nuchae and the 7 cervical fascia in the posterior aspect. When we are talking about its attachment as we move from behind to forward, so it is attached to following structure: external occipital protuberance, nuchal line, mastoid process. As you can see, it is attached to mastoid process. Then it also get attached to zygomatic bone and to the lower aspect of mandible till the level of symphysis menti in the midline. So all these black color line which you are seeing is the attachment of deep cervical fascia. In the anterior aspect, when we are talking, can you see this cross lines which I am showing you? What is it? The two sides of the investing layer of deep cervical fascia joins with each other, and when we are talking about its attachment below, it is attached to acromial process of the scapula and the spine, then it moves towards the clavicle and ultimately reaches to the manubrium sterni. Okay. So in short, what you can say, behind it is attached to ligamentum nuchae and that of 7 cervical ligamentum nuchae and the 7 cervical spine. As we move from behind to forward, starting from the posterior protuberance, external occipital protuberance, nuchal line, mastoid process, also to the external aspect of the external ear, okay, that is cartilaginous part of the external acoustic meatus, okay, cartilaginous part of external acoustic meatus, zygomatic bone, then the mandible lower border till the level of symphysis menti, meeting with the other side deep cervical fascia in the midline, and on the lower aspect it is attached below to the spine. Posteriorly we have got the scapular spine, so a scapular spine, acromial process, and then towards the clavicle and ultimately till the level of manubrium sterni. Got it? So this is all about the attachment. So my dear aspirants, write down the heading attachment of investing layer of deep cervical fascia. So write down the heading attachment of deep cervical fascia. Attachment of deep cervical fascia. Attachment of deep cervical fascia. So let's talk about the attachment of deep cervical fascia as we move from above to down. So all of this attachment. So firstly, I would like to tell you the attachment which is lying behind or posterior. So behind deep cervical fascia is attached to ligamentum nuchae. It is attached to ligamentum nuchae and that of 7 cervical vertebra spine. 7 cervical vertebra and the spine. This is the attachment behind. The second is, what is the attachment in front? What is the attachment in front? So when we are talking about the front attachment, the two sides of the deep cervical fascia, investing layer of deep cervical fascia. So we are talking about which layer? Investing layer. So first is behind, now in front, the two sides investing layer of deep cervical fascia is merging with each other. So continuous with, in front you can write continuous with similar fascia of opposite side. In the middle line, in the mid neck line. So yes, we have done with this. Now coming to, yes, good evening Neetu, good evening dear. So we are discussing the topic of deep cervical fascia. So I have just started the topic. Now coming to its attachment as we move from above, behind to forward. So write down, the next is attachment above as we move from behind to forward. This is the third attachment, above from behind to forward. So following attachments are there. Write down, the first is, starts from EOP. What is EOP? External occipital protuberance, that is superior nuchal line, to superior nuchal line of which bone? So superior nuchal line of occipital bone. Then to mastoid, then to mastoid part of temporal bone. Then is cartilaginous part of external auditory meatus, external acoustic meatus. Yes, Fatima, good evening dear. External acoustic meatus. then lower margin of zygomatic bone, lower margin of zygomatic bone, lower border of, just a minute, lower border of mandible, body of mandible, till the level of symphysis menti, okay, till the body of mandible till the level of symphysis menti, symphysis menti, done, symphysis menti, till the level of symphysis menti. So yes, now coming to the attachment below. So we have done with this, now coming to the attachment below. So below it is attached to spine and acromial process of scapula, also to the upper surface of clavicle, so upper surface of clavicle till the level of suprasternal notch of manubrium sterni, suprasternal notch of manubrium sterni. Got it? So all the attachment we have done. So we have done with all the attachments. So yes, we have done with all the attachments of the deep cervical fascia investing layer. Now next important point is we have to know the tracing. So we have to trace the investing layer of deep cervical fascia, what all structure it encloses when it is traced horizontally and when it is traced vertically. So in short, we have done with the attachment. Next important point is the tracing of deep cervical fascia, both the layers. So I would like to show you this diagram. So this is the diagram which is the transverse section. This is the diagram which is showing you the, it's a transverse section and here of the cervical region of the neck, and you can see the horizontal tracing of deep cervical fascia. So exactly with this diagram you can make out horizontal tracing of deep cervical fascia. Okay, so next is to understand. So let's start with the horizontal tracing of deep cervical fascia. So let's start with the tracing. So when traced forward from the ligamentum nuchae, so here you can see, for example, I would like to use blue color, so to make it advisable for you to understand. So let me slightly enlarge it. Yeah. So yes, you can see here this is ligamentum nuchae. Okay. So let me. Okay, I am using black color only. So this is ligamentum nuchae. Got it? So it from the ligamentum nuchae it is starting, as you can see, the posterior aspect, and after that it is enclosing one muscle. What is this muscle? So it is enclosing trapezius muscle. As you can see, it is enclosing trapezius muscle on both the side. Okay. So it encloses the trapezius muscle starting from ligamentum nuchae, and at the anterior end again what happens, it will form the it will form the roof of the posterior triangle, and thereafter again it will enclose another muscle, that is sternocleidomastoid muscle. So this is SCM, sternocleidomastoid muscle. So it again encloses sternocleidomastoid muscle. Again at the anterior border of sternocleidomastoid muscle, the two layers which has been splitted. So two times the investing layer of deep cervical fascia is splitting. Firstly at the posterior aspect, as you can see, it is enclosing T for trapezius muscle. Again it fuses and form the roof for the posterior triangle, and anteriorly it is forming the roof for the anterior triangle. So it is forming roof of two triangles, the anterior and the posterior triangle, and enclosing two muscles, sternocleidomastoid and trapezius muscle. So this is all about the horizontal tracing, and after that we will see the vertical tracing of the investing layer. So right now the same thing which we have seen in the diagram, I would like to give you the details. Raja Ram, good evening dear. So write down the heading horizontal tracing of deep cervical fascia. Horizontal tracing of deep cervical fascia. Okay. So when we are talking about horizontal tracing of deep cervical fascia, It is traced like this. First point is when traced forward from ligamentum nuchae. So, firstly thing is that it is traced forward from ligamentum nuchae. The fascia splits to enclose, the fascia here splits to enclose. So, firstly posterior aspect, it was enclosing which muscle? My dear aspirants, it was enclosing which muscle? It splits to enclose trapezius muscle. It splits to enclose trapezius muscle, and at the anterior border of the muscle, it extends forward, forming the roof of posterior triangle. It is forming the roof of posterior triangle. So, it extends forward, forming the roof of posterior triangle. Got it? It will extend and form the roof of posterior triangle. At the posterior border of sternocleidomastoid muscle, it will again split. So, at the next point is at the posterior border of which muscle? Sternocleidomastoid muscle. I am writing in short form SCM, sternocleidomastoid muscle. It again splits. So, again it splits. It splits again to enclose SCM, again the SCM muscle. Which muscle? SCM muscle, that sternocleidomastoid muscle, when splitting at the posterior aspect, enclosing the sternocleidomastoid muscle, and then reunite at the anterior border, of SCM, sternocleidomastoid muscle, reunite at the anterior border of SCM and will form the roof of anterior triangle, and will form the roof of anterior triangle of the neck, So, everyone, is it okay? Have you understand the whole thing what I have told you? Same thing. Firstly, starting from the ligamentum nuchae, enclosing trapezius muscle, then again forming the roof of posterior triangle, again enclosing the sternocleidomastoid muscle, and again uniting and forming the roof of anterior triangle. So, done. This is all the horizontal tracing. Next important point is the vertical tracing. So, write down the heading, vertical tracing. Vertical tracing of investing layer of deep cervical fascia. Vertical tracing of investing layer of deep cervical fascia. So, I would like to show the diagram first and then I will come up here. So, see here, when we are talking about vertical tracing, what you can appreciate here when we are talking about vertical tracing, that investing layer of deep cervical fascia, when we are tracing it above the hyoid bone. So, when it is traced above the hyoid bone, can you see here, this is the hyoid bone. So, when it is traced above the hyoid bone, it is splits to enclose, it is splitting to enclose submandibular gland. As you can see here, it is splitting to enclose submandibular gland. So, at the level above the hyoid bone, it splits to enclose the submandibular gland as shown in the diagram. The superficial fibers encloses the superficial aspect of the gland and it is attached to that of the body of mandible as shown in the diagram. It is attached to the body of mandible and the deeper aspect of it will be attached to the mylohyoid line of mandible. So, when it is splitting when it gets, so when we are talking about vertical tracing, we will know the vertical tracing of investing layer of deep cervical fascia above and below hyoid bone. So, I am talking about the level above the hyoid bone, the first structure. So, it will split, it will form superficial and deep layer. Superficial layer is attached to the body of mandible, deep layer encloses the gland and attaches to mylohyoid line of the mandible. Now, posterior to submandibular gland, then again it splits and now it is including another gland, that is parotid gland. So, now it is enclosing another gland, that is parotid gland. Got it? So, it is enclosing the parotid gland As it splits once more, superficial fibers will form superficial parieto-mesenteric fascia. Actually, the superficial aspect of investing layer of deep cervical fascia, which is covering the parotid gland, is more tough, adherent, and it will form parieto-mesenteric fascia. The deeper aspect, it will form stylomandibular ligament, which is attached to tympanic plate and the external acoustic meatus, and the condensation of investing layer of deep cervical fascia is forming a ligament. What is the name of ligament? Stylomandibular ligament. This stylomandibular ligament will separate, it forms a separation for two glands. One is the submandibular gland and other is the parotid gland. So, write down this information, then we will move on to the next. Vertical tracing. So, when traced, the first point is when traced above the level of hyoid bone, when traced above the level of hyoid bone. So, when traced above the level of hyoid bone, it splits to enclose the submandibular salivary gland. Submandibular salivary gland. Okay, submandibular salivary gland. It encloses the submandibular salivary gland. Now, what about the superficial layer which is covering it? So, when we are talking about the superficial layer of the investing, superficial layer which is covering the submandibular gland, it is attached to lower border of body of mandible. Lower border of the body of mandible. This is about the superficial layer. What about the deep layer? So, see here, when we are talking about the deep layer, so the deep layer is attached to which structure, which I have told you, it is attached to mylohyoid line of mandible. Mylohyoid line of mandible. Got it? Ma'am, this video will after the live class is over. Ma'am, this video available after the live class is over? Yeah, it will be available there also. Okay, yes, it will be there on the platform of Let's Crack NEET PG YouTube channel. It will be there, so you can access this. Don't worry. But if you want to understand now, you can have you can clear my doubt, your own doubt, write itself. Don't worry. Okay. So, mylohyoid line of the mandible, it is attached, deeper aspect, and posterior, when we are talking about posterior to submandibular gland, posterior submandibular gland at the lower pole of parotid gland, it splits to enclose parotid gland also. So, that means two glands has been enclosed by investing layer of deep cervical fascia. One is the submandibular gland and other is the parotid gland. Okay. So, here what happens when it is enclosing the parotid gland, what we have seen in the diagram also, the superficial layer will form a very adherent structure that is called as parieto-mesenteric fascia. Okay. The superficial layer is strong. So, what you can say, when it is enclosing the parotid gland, here you can write down superficial layer is quite strong. Superficial layer which is covering the parotid, superficial layer over the parotid gland is strong. And why it is strong? Because it is forming an adherent structure. What is it? What is the name of that structure? That is called as parieto-mesenteric fascia. Parieto-mesenteric fascia. Parieto-mesenteric fascia, and in this condition the fascia is attached to the lower border of zygomatic bone. So, here it is attached to zygomatic bone. Which border? Lower border. Zygomatic bone se attach hota hai to the lower border of zygomatic bone. Now, what about the deeper layer? So, when I am talking about the deeper layer will pass deep to parotid gland. The deeper layer will pass deep to parotid gland and get attached to tympanic plate. It will be attaching to the tympanic plate of temporal bone and stelloid process of temporal bone. So two structure it attaches of the temporal bone, two structures पे ये attach होता है. The two structures are, one is tympanic plate and the other is stelloid process of which bone? Temporal bone. It is attached to which bone? Temporal bone. So the part of the investing layer which is stretching between the angle of mandible and stelloid process is forming a ligament, that is stylomandibular ligament. So investing layer of deep cervical fascia, if we talk about the investing layer of deep cervical fascia which is found to be stretching between the stelloid process and angle of mandible is forming stylomandibular ligament, and it is separating two glands from each other, that is SMG, submandibular, from the parotid gland. So investing layer of deep cervical fascia stretches between the stelloid process to the angle of mandible, and what is it forming? So the next point is, what is it forming? So it is forming which ligament, my dear aspirants? It is forming stylomandibular ligament. It is forming stylomandibular ligament. This stylomandibular ligament is separating which two structure? It is separating two glands, that is parotid gland and submandibular gland. Now we have done, so I have done with the details of the vertical tracing of deep cervical fascia investing layer above the level of hyoid bone. Now what I want you to know is the stretching below the level of hyoid bone. So yes, I will show you that diagram also. So let me first tell you about below it also. So let me show one diagram for it and then again we will see. Yeah. So one of this diagram will help you to understand. So what happens when it is stretched below the hyoid bone, when it is traced downward, the fascia will split twice and it will enclose two spaces, one spaces. So as you remember, when it was showing in the attachment, I have told you it is attached to which two structure? It is attached to clavicle. Okay, and it is attached to clavicle also, and it is attached to the suprasternal notch. So here when it is attaching to the clavicle, the superior 1/3 part of it where it is splitting. So in the middle 1/3 of the clavicle it is attached, splitting to enclose a space, and this space as you can see is the supraclavicular space. Can you see here? This is the supraclavicular space, and it is important for your Viva examination and for your MCQ that you should know which structures are lying in the space. Okay, so this is important for you to know. So here you can see one of the structures, supraclavicular nerve. So actually in the stretching of you can say when it is extending from the lower aspect of hyoid bone, investing layer of deep cervical fascia will split one near the clavicle and it will enclose a space that is called a supraclavicular space. Another space which it encloses is the suprasternal notch. That space is suprasternal space of Bern. So two spaces are enclosed, and it is important for us to know which all structures lies in this space. So let me tell you about that. So write down, when traced downwards, that is from the level of hyoid bone, the investing layer of deep cervical fascia, the investing layer of DCF, deep cervical fascia, splits to enclose two spaces, What are the two spaces which is enclosed, my dear aspirants? So it is enclosing two spaces. One is above suprasternal notch. One is above suprasternal notch. It splits to enclose one space, that is suprasternal notch, and this space is called suprasternal space of Bern, and it is attached to the anterior, and posterior border of suprasternal notch. It is attached to the anterior and posterior border of suprasternal notch. Okay. Now, next important point is to know that which all structure is enclosed here. If it is attached to suprasternal space, it is enclosing a suprasternal space. So, it is to know that which all structures are lying there. Okay. So, two spaces are there. One is supraclavicular space. So, firstly we will study about suprasternal space, which is containing the structures like sternal head of sternocleidomastoid muscle, jugular venous arch, interclavicular ligament and certain lymph nodes. Okay, so 4 structures are lying in the suprasternal space of burn. So, write down the heading suprasternal space of burn. So, suprasternal space of burn is enclosing 4 spaces, 4 structures. What are they? The 4 structures enclosed are sternal head of sternocleidomastoid muscle. Sternal head of sternocleidomastoid muscle is enclosed. Other than that, it encloses jugular venous arch. Jugular venous arch. It encloses jugular venous arch. Other than that, it encloses interclavicular ligament. Interclavicular ligament, and other than that it encloses lymph node at times, lymph node sometimes. So, how many? 4 structures. Now, above the middle 1/3 of clavicle, so this was done with this was the suprasternal space. As I told you, one more space is very important for you to know, that is the supraclavicular space, which is lying just above the middle 1/3 of clavicle. So, yes, let me know, are you understanding, those who are hearing? Okay. So, let me tell you about one more space. So, here you can write down, this is suprasternal space, but the other space, so above middle 1/3 of clavicle, as I told you, it again splits into 2 layers, anterior and posterior, and here it is enclosing a space that is called as supraclavicular space. Supraclavicular space. And in supraclavicular space, it is enclosing following structures. So, which structure it encloses? It encloses 2 important structure. It is enclosing terminal part of EJV, that is external jugular vein, and supraclavicular nerve. Supraclavicular nerve. Got it, everyone? So, these are the structures which is enclosed by the 2 spaces formed by the investing layer of deep cervical fascia. So, yes, we have done with this. What is most important for your examination point of view and for your MCQ session, that and for enumeration questions, that you should know that all the structures which is enclosed by investing layer of deep cervical fascia can be studied by a name, that is the rule of 2. Why? Because it encloses too many structures which are 2. So, please write down that also. So, yes, done with this. Now, we will again, so just write down to sum up at the end, to sum up. So, yes, we have done with the important modification for the investing layer of deep cervical fascia, to at the end to sum up. So, are you understanding? Let me know. To sum up, at the end to sum up, investing layer of deep cervical fascia encloses following structures, encloses following structures, that you can say rule of 2 is also applied and encloses following structures. What are the structures enclosed? Please write on the list. So, yes, you must be knowing also splits to enclose 2 muscles. So, 2 muscles it encloses. What are they? 2 muscles. Anyone remembers what are the 2 muscles enclosed by the investing layer of deep cervical fascia? Sternocleidomastoid and trapezius muscle. Got it? Yeah. Forms the roof of 2 triangles, forms the roof of 2 triangles. What are it? Which 2 triangles roof it forms? It forms the roof of posterior triangle of neck and anterior triangle of neck. So, it forms the roof of posterior and anterior triangle of neck. It encloses 2 glands. So, it encloses two glands. What are the two glands enclosed? Submandibular gland and parotid gland. Forms two sling. It also forms two sling, and the two slings which is formed is the sling of, it forms a sling for inferior belly of omohyoid. It forms sling for inferior belly of omohyoid, and also form intermediate tendon of digastric muscle. Intermediate tendon of digastric muscle. It also give rise to two space processes. So, it is enclosing two things, it forms two spaces also. So, yes, it also forms, it encloses two spaces. What are the two spaces which is enclosed by them? One is suprasternal space of Berne and the other is supraclavicular space. Supraclavicular space. It also forms two fascia. So, actually two fascias arises from its, I am writing in short form PT and VT. What is that? It give rise to pre-vertebral layer of deep cervical fascia and pre-tracheal layer of deep cervical fascia. So, it is enclosed, it is forming, giving rise to two fascia. These two fascias are also rising from it, pre-vertebral fascia and that of pre-tracheal fascia. So, this is how we have done with the investing layer of deep cervical fascia. Now, moving on to the next. Before moving on to the next, I would once again like to show you the investing layer of deep cervical fascia in this diagram. So, here a very clear picture, very nicely you can see here. It is attached to this hyoid bone. Above it is enclosing, as you can see, it is attached to the mandible, and we have already seen above the hyoid bone it is enclosing two glands. Lower to the hyoid bone it will go towards the mandibulosternal joint forming suprasternal space of Berne. This is the suprasternal space of Berne which is shown. This will be the suprasternal space of Berne. It is also called as suprasternal space of Berne. Yeah, and also as you can see in this diagram, here this investing layer is attaches lower to manubrium sterni. So, this is the how investing layer has been shown in this vertical tracing, or you can say in this sagittal section. Yeah. So, one more diagram is there, let me show that diagram also. So, here one more diagram similar to that. Hyoid bone is here, from where it is passing above to enclose the glands. Lower to it you can see this is the investing layer. So, this is the investing layer, and just dividing into two layers and enclosing the manubrium sterni, and above also as you can see it is dividing and attached to the mandible bone. Okay. So, yes, this was which layer? This was the investing layer of deep cervical fascia. Now, let us move on to the next layer, that is pre-tracheal layer. Next layer is the pre-tracheal layer. Pre-tracheal layer, this is the second layer of deep cervical fascia. So, low inside the investing layer we get the second layer, that is the pre-tracheal layer. Pre-tracheal layer is again it is also arising from the investing layer of deep cervical fascia, and it covers the sides and the fronts of trachea, and it splits to enclose a gland, that is thyroid gland. So, it splits to enclose a gland, that is thyroid gland, and from there it is attached to the arch of cricoid cartilage. Okay. So, pre-tracheal layer is arising from deep cervical fascia investing layer only, and covers the side and front of trachea. So, it is covering the sides and the front of trachea, forming pre-tracheal layer, PT for pre-tracheal layer. It splits to enclose, thyroid gland. It is enclosing the thyroid gland. forming a capsule for the thyroid gland. It will form a covering or a capsule for the thyroid gland, forming a capsule for thyroid gland, forming capsule for thyroid gland, and is attached to cricoid cartilage anteriorly. Cricoid cartilage anteriorly. It is attached to cricoid cartilage anteriorly. Got it? Actually, there is one other modification also, that is called as ligament of Berry. So, actually what happens, a fibrous band which is extending, which is called as ligament of Berry, is derived from the pre-tracheal layer, and it is connected to the capsule, thyroid capsule lateral aspect. It is connected from here to that of cricoid cartilage. So, actually pre-tracheal layer is forming ligament of Berry. So, yes, a fibrous band called as ligament of Berry is derived from pre-tracheal layer of the fascia and forms a connection between. So, it connects the capsule of thyroid gland, lateral lobe, to the cricoid cartilage. To which structure? To the cricoid cartilage. Got it? So, yes, got it. It is connecting to the cricoid cartilage. This was about the tracing which we have. So, after that we will also go with the tracing of horizontal and vertical. So, yes. Now, again I would like to show that diagram, so that here one more thing is shown as in this diagram. Again let me use blue color for the pre-tracheal layer. So, a green color is the investing layer of deep cervical fascia. Pre-tracheal layer, as you can see, it is arising from the investing layer only, and it is also forming an anterior layer of carotid sheath, okay, on which the roots of ansa cervicalis is lying, and it is a whole covering. Can you see? It is whole forming a covering for which gland? Thyroid gland. So, yes, as you can see in the diagram, this whole thyroid gland is covered by which layer? Pre-tracheal layer, and it is also forming the anterior layer of, as you can see, on which it is stud is the root of ansa cervicalis. So, it is forming the anterior. It is arising from the investing layer of deep cervical fascia only. It is arising from the investing layer of deep cervical fascia, posterior to that of sternocleidomastoid muscle, and then it is forming a covering for the pre-tracheal layer, lying just below, as you can see, to infrahyoid muscles. It is just lying below infrahyoid muscles. Okay. And you can see posterior, just here on the transverse section posteriorly, we have got, this is T for trachea and this is esophagus. So, this is all about pre-tracheal layer. So, when traced horizontally, what happens when it merge with investing layer of deep cervical fascia enclosing the sternocleidomastoid muscle and forming the anterior layer of carotid sheath. So, yes, we can clearly see in the horizontal tracing. In the horizontal tracing, as we can see of the pre-tracheal layer, it is exactly arising from the sternocleidomastoid muscle ke posteriorly, this investing layer forming anterior wall of carotid sheath, and it is also enclosing the thyroid gland as shown in the diagram. So, this is the details of the pre-tracheal layer which is shown here. So done with this. So, yes. Now, at the end I will show you different layers as shown in different colors. Now, I would like to show you the vertical tracing. Now, see this diagram. Here when we are talking about the pre-tracheal layer as shown in blue color, can you see here? So, what you can see in the vertical tracing, when it is traced above, to hyoid, what happens is passes in front of the thorax, in front of trachea, and it is merging with the, as you can see, thyroid cartilage, cricoid cartilage, and ultimately lower down it merges with which structure? As you can see, it is merges with the fibrous pericardium. So, from above to downward, when traced above the hyoid bone, okay, when traced when traced above, it is attached to the hyoid bone and it is also forming attachment to the thyroid cricoid cartilage. Lower down, it attaches to the fibrous pericardium. So, this is about horizontal and vertical tracing. Let me show you in this diagram. So, here you can see this is the hyoid bone. From the hyoid bone, it is I am using blue color. It is attached to the thyroid cartilage. It is attached to the cricoid cartilage. Lower down, it is moving, forming and enclosing the gland. Which gland it is enclosing? Thyroid gland. Lower to it, it is merging with which structure? Fibrous pericardium. Which structure? Fibrous pericardium. So, this is the whole details of pretracheal fascia. So, write down this detail. All of you, please write down this detail. Okay, now let me just show you another view which is very schematic diagram to make you understand. So, here also we can appreciate vertical tracing. We can appreciate vertical tracing of pre-tracheal layer of deep cervical fascia. Of which layer? Of deep cervical fascia. So, from the hyoid bone it is arising, then lower down it encloses thyroid and the cricoid cartilage. Thereafter, it splits and encloses. It forms a capsule, fibrous capsule or false capsule for thyroid gland. Ligament of Berry can be clearly seen in this diagram, which is extending from the capsule of thyroid gland and attaches to the cricoid cartilage, and lower down it is merging with the fibrous pericardium. Fibrous pericardium. So, is it okay everyone? Are you understanding? Okay. So, let us move on with the. So, let us write this information so that afterwards you can revise it. Horizontal tracing. Horizontal tracing of PT means pretracheal layer of deep cervical fascia. So, firstly about horizontal tracing. Now, when traced horizontally, it merges with investing layer of deep cervical fascia. It merges with investing layer of deep cervical fascia, encloses the sternocleidomastoid muscle and forms anterior wall of carotid sheath. And forms anterior wall of carotid sheath. Got it? Now, coming to vertical tracing. Now, coming to the vertical tracing, this was A, that is horizontal tracing, this is B, that is vertical tracing. So, moving on to this detail, when traced above, it is attached to, when traced above, it is attached to hyoid bone, and when traced below, it enters the thorax, it enters the got it? It enters the thorax in front of trachea, and lower down it blends or merges with apex of pericardium, apex of fibrous pericardium. So, done with this. So, this is all about the horizontal and vertical tracing of pretracheal layer. Done. Now, let us move on to the prevertebral layer. Next is prevertebral layer. So, now let us move on to the third layer, that is prevertebral layer. Prevertebral layer of deep cervical fascia. Prevertebral layer of deep cervical fascia. Actually, it's a strong one. So, it's a strong fascia. It is a strong layer which lies in, it's a very strong layer, and it is if we talk about its horizontal and vertical tracing, when we are tracing it horizontally, what happens? It is also arising from the investing layer of deep cervical fascia, and thereafter what happens? It covers the scalenus group of muscle, levator scapulae muscle, splenius capitis muscle, and there it forms a fascicle carpet for the posterior triangle of the neck. And actually it is important for us to know also that if we talk about the roots of brachial plexus or the cervical plexus, it's lying deep to prevertebral layer, and as the trunk of brachial plexus and subclavian vessels are emerging out, mainly the subclavian artery which is emerging out in between the scalenus group of muscle, it is covered by a layer of prevertebral layer which forms axillary sheath when it reaches the axilla. So write down tracing, the horizontal tracing. When traced laterally, when it is traced laterally, it covers scalenus, muscle, levator scapulae muscle, these are the muscles of levator scapulae, splenius capitis muscle, forming fascicle carpet for, and these are, and here it forms fascicle carpet of posterior triangle of the neck. It forms a fascicle covering for the posterior triangle of the neck. The roots of brachial plexus, the roots of cervical plex and that of brachial plex lies deep to it. And as I told you, this has been asked as an MCQ session also. When the prevertebral layer reaches in the axillary region, it forms axillary sheath. It forms axillary sheath. So please write on that also. As the trunks of brachial plexus and that of subclavian artery, so as the trunks of brachial plexus and subclavian artery emerges between, when it is emerging, so it emerges between scalenus anterior muscle and scalenus medius and that of scalenus medius muscle, and moves towards the axilla. When it is moving towards the axilla, the covering, that is the prevertebral layer, in this instant will form axillary sheath. So what it will form? It will form axillary sheath. So they will cover the sleeve of prevertebral. So what happens? Where the sleeve of prevertebral layer, when it reaches the axilla, will form axillary sheath. Got it? Will form the axillary sheath. So this was about the tracing. Now vertically trace करें, अगर हम उसको vertically trace करें, तो what will happen? Above it is attached to the skull. So you will just see this diagram also. I will come to this before that. So once again I would like to show this diagram to you. Yeah, in the heart. So let me now concentrate about which layer? Prevertebral. So I am just rubbing other one. Now let us see the prevertebral layer. So in this diagram, yeah, so this is the prevertebral layer. As you can see, what I told you, it arises from the posterior aspect of the investing layer of deep cervical fascia. It is forming the posterior layer of carotid sheath. This is the posterior layer of carotid sheath, and it is forming a covering. Here it is forming a covering for the muscles which is lying posteriorly, like scalenus group of muscle, levator scapulae, scalenus capitis. Can you see here? These are the muscles which is lying in the floor of posterior triangle and muscles of back. So these muscles are whole covered. Neck में back में होता है. These muscles are whole covered by prevertebral layer, and this prevertebral layer is forming the floor for the posterior triangle of the neck. See here. This is all covering these all muscles. Got it? This is the prevertebral layer. Now coming to the vertical tracing. So again I will rub all these. Now we will see the diagram. In the same diagram we will now see the prevertebral layer. So see here, in the prevertebral layer, above the hyoid and the upper aspect, it is attached to base. It is attached to base of skull. It is attached to base of skull, and lower down, as you can see here, it is merges. It merges. It is attached to the base of skull, and it is merging with that of the vertebrae, thoracic vertebrae. Okay, it is merging with T1 to T3 vertebrae and that of anterior longitudinal ligament. So here it is merging, as you can see here, from the base of the skull to that of extends and merges or blends with anterior longitudinal ligament of upper 3 thoracic vertebra. Most cases upper 3 only, otherwise it can merge with the upper 4 also at times, but T3 is most important. Till the level of T3 anterior longitudinal ligament, it merges with it. Okay. Now thereafter, let me write about horizontal and that of vertical tracing of prevertebral layer. So we have already done with now write on vertical tracing. Now we have already done with the horizontal tracing. Next is the vertical tracing. Traced above, when traced above the base of skull, traced above, it is attached to the base of skull, and below it is attached to, it lies below, it passes in front of longus colli muscle, and lower aspect, it blends with anterior longitudinal ligament of, ligaments of upper thoracic vertebrae. It blends with the upper thoracic vertebrae. Got it? So yes, this is about the merging of the prevertebral layer as we move from, as we are merging it, and the posterior and anterior aspect. So we have seen the vertical and the horizontal tracing. Thereafter, what is important for us to know? Now, when it is actually, it is also important that in case of the prevertebral layer, two important spaces are enclosed, and two important spaces in relation to it is, one is the retropharyngeal space and other is the danger space of the neck. So you have to know the details of it. So actually what happens, if we talk about the two layers which is formed, so anteriorly prevertebral layer of deep cervical fascia is separated from the pharynx, and there it is lying close to the covering, that is buccopharyngeal fascia, and actually the prevertebral layer is also forming two layers. One is the anterior layer which is forming the alar fascia, and the posteriorly it merges with the anterior longitudinal ligament. So for that instant I have to show you a diagram for it. So see here, in this diagram you can clear, this concept should be clear to you that there are actually two spaces. So let me first describe you the retropharyngeal space. So retropharyngeal space as shown with the yellow color, it is lying anterior to the danger space. So let me use red color for the danger space of the neck. So you can see here, this space is exactly lying between the posterior pharyngeal wall. Okay, if we talk about retropharyngeal space, so yes, let me not use red color so that you will confuse. Let me use black color only. So this is retropharyngeal space. So it is lying between the posterior pharyngeal wall layer and that of alar layer of deep cervical fascia. Okay. So alar portion of prevertebral layer के बीच में, anterior to the alar portion of prevertebral layer and that of posterior pharyngeal wall, the yellow color space which you are seeing is the retropharyngeal space in this sagittal section. Posterior to it, the red color space of the neck which is shown in the sagittal section is the danger space, which is lying exactly between the alar portion of deep cervical fascia and prevertebral portion of deep cervical fascia. That means anterior to danger space lies the retropharyngeal space, which is also called as space of Glitti. So write down. This difference is very important for you to know. Anterior to prevertebral layer of deep cervical fascia, anterior to prevertebral layer of deep cervical fascia the anterior to prevertebral layer of deep cervical fascia, the space lying between buccopharyngeal fascia covering the pharyngeal muscles, and the alar portion of prevertebral layer is called as retropharyngeal space. Which space is this? This is the retropharyngeal space. Retropharyngeal space is also called the space of gluteus, which is again divided into two compartments, okay, containing retropharyngeal lymph node. Okay, so that means the prevertebral layer is having anterior layer as alar portion and posteriorly it is the prevertebral layer. So exactly if we talk about the danger space, that is between, and if we talk about danger space of neck, it is lying posterior to retropharyngeal space and it is exactly between the alar portion of prevertebral layer and that of prevertebral layer itself. Okay, prevertebral layer itself. This prevertebral layer, alar portion is the anterior, part of prevertebral layer, and the prevertebral layer is the part which is merging with AL. What is this? Anterior longitudinal ligament of upper 3 thoracic vertebra. Okay, that means the prevertebral layer itself is divided into two layers. Anterior is called as alar portion and posteriorly it is merging with anterior longitudinal ligament. So the space exactly between the alar portion, the space which is lying exactly between the alar portion of the prevertebral layer and that layer which is merging with anterior longitudinal ligament, that space is called as the danger space of neck. Anterior to it, the space which is lying anterior to the danger space of the neck lies the retropharyngeal space between the buccopharyngeal fascia and alar portion of prevertebral layer. Got it? Is this clear to you? This is important for you to know the differentiation. Now next I just want you to describe carotid sheath. Before that I just want to show this diagram. Actually in this diagram you can see the three different layers has been shown with different color. Okay, so here superficial investing layer is shown with the, as I told you that the layers which you see is designated by different colors. So we can see here exactly the blue color has been used as most superficial layer, that is the investing layer, and pink color has been used for which is forming a covering for thyroid gland and all. This is the pre-tracheal layer, and posteriorly the layer which is shown here is the prevertebral layer, and here the whole detail of the prevertebral layer. So here you can see here this is the prevertebral layer and danger space and retropharyngeal space has been drawn. Okay, so in this diagram what you can see, the danger space is lying posterior to retropharyngeal space. Okay, so here in this diagram also in the enlarged view we can see the prevertebral space, danger space and retropharyngeal space has been shown. Prevertebral space is the space which is lying posterior to prevertebral layer. Most anteriorly the space which is lying is the retropharyngeal space, then is danger space, and then is the prevertebral space. Okay, here also you can clearly see these three spaces has been shown, and the most anteriorly is retropharyngeal space, then the danger space, and the posteriorly is the prevertebral space. More clearly you can see in this diagram, very clear, we have already discussed this. Now let us move on to the carotid sheath. So write on the heading, actually this carotid sheath content has been asked as a question for the last year AIIMS entrance exam. So you have to know the carotid sheath and space. You have to know the details of carotid sheath. So actually carotid sheath is actually formed by the modification or extension of investing layer of deep cervical fascia as the prevertebral and that of pre-tracheal layer only. And this is important, why? Because it is forming a sheath for the carotid artery. So carotid sheath is containing which all structure? It contains common carotid artery, it contains internal carotid artery, it contains internal jugular vein and that of vagus nerve. Okay. In this category, arteries are lying medial, veins are lying lateral, and vagus nerve is lying behind between artery and vein, between artery and vein. Next important things is how it is formed and what all structures it contains. Okay, how is anterior wall formed, what is it is containing, that all is very important for you to know. So let's move on to that point. Anterior wall of carotid sheath. Anterior wall of carotid sheath is formed by pre-tracheal layer. Pre-tracheal layer. Posterior wall of carotid sheath is formed by pre-vertebral layer. Pre-vertebral layer. Got it? Posterior wall by pre-vertebral layer, anterior wall by pre-tracheal layer. Structure piercing. Now you should also know the structures piercing carotid sheath. The structures piercing carotid sheath are following. The structures piercing, we have got few more structures which is piercing carotid sheath, and it is important for you to know the structures piercing is ECA, external carotid artery, tributaries of internal jugular vein. Then we have got ninth cranial nerve, we have got accessory nerve also, and we have got hypoglossal nerve, which is also piercing it, and also cervical branch of vagus nerve is also piercing it. Also cervical branch of 10th cranial nerve or the vagus nerve is also piercing it. These all structures are piercing it. These all structures are piercing the carotid sheath. One more important point is that when we talk about cervical part of sympathetic trunk, that is lying just posterior, that is separated from the posterior layer of carotid sheath, pre-vertebral layer. So posterior to pre-vertebral layer. If you talk here, the important point, posterior to the pre-vertebral layer and posterior wall is formed by pre-vertebral layer, there lies, it contains in the posterior wall, exactly the posterior wall of pre-vertebral layer, it's having on the posterior aspect, it is having cervical part of, it is related to cervical part of sympathetic trunk. Okay. So more posteriorly is exactly the pre-vertebral layer, and in that point only we know that posterior wall is also derived from pre-vertebral layer. In that area there is loose areolar connective tissue, and in that areolar connective tissue lies cervical part of sympathetic trunk. So done with this, all the important point, this is also very important for your MCQ session. Now let's before that I would like to show you this diagram. So here you can clearly see on when we are talking about, see here the contents are internal jugular vein, vagus nerve, internal carotid artery and all. External carotid artery is piercing it, not the content. Ansa cervicalis lies on the anterior wall of the carotid sheath, and other posteriorly it is related to sympathetic chain cervical part. So done with this. Now before ending the session, I would like to tell you about the information. Okay. Free live classes on the Unacademy platform can be seen by using my code ANAT10, and the free session which I am taking is, so tomorrow 2 sessions are there, 6 p.m. session and then there will be 7:30 p.m. So please note down, 2 sessions are there tomorrow. First is 6 p.m. session and then 7:30 p.m. session. So 6 p.m. and 7:30 p.m. you can join me. Exactly the timing will be, please note down, the exact timing of this session will be 7:30 p.m. Okay, 7:30 p.m. So 2 free sessions, 6 p.m. session on YouTube and 7:30 p.m. session will be on the Unacademy platform. For unlocking the code is ANAT10. If you want to see the free session on the Unacademy platform, use the code ANAT10 for unlocking it. What are the benefits of Plus subscription? So when we are talking about the benefits of Plus subscription, you can avail this opportunity where you can access both live and recorded version. And many sessions are going simultaneously on the platform of Unacademy. You can either be the part of it live. So most important is that be present live so that you can have interaction with the educators there itself. You can ask and clear your doubts. But other than that, you can also be the part of recorded version. You can also be the part of recorded version. So what that means, you can see number of times if you require. Now you can study from the top educators of medical team, study on a device of your choice and assess the QBank. So you can assess the QBanks. More than 25,000 QBanks are there, which is of high yield QBanks of all the subject, 19 subject. These QBanks are made from the top educators of Unacademy platform. So compete with live tests and quizzes, and also soon you will get printed notes if you are taking the subscription of more than 1 year. So the code which can be used by you is ANAT10 for 10% discount. Study at your device at your place with the top educators present live and get your targeted rank. Simultaneously number of sessions are going on, you can join any of it, have a live classroom rank sessions, get your all doubts cleared, you will get printed notes also provided to you with 1 year subscription and more. Soon it is coming on the platform, and every 4th session is a doubt clearing sessions, and number of times is not restricted. In case of plus subscription, you can see many times. Now after telling you the benefits of the plus subscription, I would like to tell you the benefits of iconic subscription. If you are going for iconic subscription, that means you will get the benefits of Prep Ladder platform also. So all the clinicals and the integrated essential courses can be assessed, video lectures can be seen from the Dream Team, QBank 3 can be assessed, rapid revision, snapshots, stressors, dream notes will be provided to you. So these are the benefits which will be availed by you, and it will be highly beneficial for you. So the other important point is that you can avail this opportunity, and you can have the dream notes of the Prep Ladder. You will get the printed notes along with it QBank 3. So what I suggest, if you are going for NEET PG examination, if you are targeting next exam INICT, you should definitely go for iconic subscription, because live class benefit is already given to you by the plus subscription of Unacademy. Other than that, you will also get the benefits of recorded sessions and QBanks of iconic Prep Ladder. Now batches starting 25th is the Focus FMG batch, NEET PG 2021 and Target Next 2022 batch. So whichever suits you, be the part of these sessions. Then NEET PG 1 month package, ultra fast revision batches, emergency room MCQ batch, NEET PG analysis batch, last 3 year NEET PG questions batch, COVID test batch, and grand test series batch. Okay, grand test series batch, all these things can be can get you in the 1 month package, and you can assess it. Use the code ANAT10 for unlocking the session and be the part of the session, and take the subscription. Use this for 10% discount. I also want to tell you about the updated and highly effective sessions where you get 25,000 and more high yield clinical MCQs based on latest exam pattern, includes a detailed explanation. Use the code ANAT10 for unlocking the session, and you will get 10% discount if you are using this code. Grand test schedule before the examination of NEET PG has been here. The timetable is discussed. Be the part of this grand test, highly beneficial. Take 4 years of subscription. If you are residing in first or second year, either you can go for plus subscription or you can go for iconic subscription, where the subscription benefit of both Prep Ladder and the Unacademy subscription is added on. If you take 12 months of subscription, you get additional 2 months of subscription absolutely free. For 1 month of subscription, that is 4,500, it's just costing that much. You will get a discount of 450 rupees by using the code ANAT10. I would also like to proudly share the name of the star educators of our star educators on the Unacademy platform, those who have cleared their examination with a very good marks. They are Dr. Razmin Patel, Dr. Gayatri, Dr. Neha, Dr. Anudeep, Dr. Subham, Dr. Pooja Mukuvino, Dr. Siddharth, Dr. Arun, Dr. Eliza Philip, and Dipti Nisal. So I would like to congratulate all of them. They have scored such a nice marks, and all the best for their future. And at the end, I would like to share this slide where the pricing detail of NEET PG and iconic subscription has been discussed. So you can see this screen, and where you can clearly know that what are the difference between the subscription of iconic and the NEET PG for different years and the months, whether you can go for 4 years, 3 years, 2 years. If you are in 4th year, final year, then you take 2 years of subscription. Otherwise, if you are in 1st or 2nd year, go for 4 year subscription. Either you can take iconic or you can go for the plus subscription. So all the best. Use my code NAT10 to avail the opportunity of 10% discount. All the best. Keep studying. Thank you so much. Thank you so much, dear. So tomorrow also 6 p.m. will be the YouTube session and 7:30 p.m. will be the special class, free session on the platform.